In the year 2020 and 2021, the government of India, they had released a new report called as Medical Certification Report on the Medical Certification of the Cause of Death based on the year 2019 surveys. So we are going to discuss, one is about the medical certification cause of death. There can be questions on that. And we are also going to talk about topic number 2 is about the death certificates. So let us first have a look at what does the report say on the medical certification cause of death. There could be related MCQ. There was 2 exams last year and both of the exams they had question on these. So this is definitely a high yield area for you. First MCQ is that which is the most common cause of death in India? The most common cause or leading cause of death in India in year 2019, you can note that it was the cardiovascular system. If you just look at the pie chart over here, that you can see that majority 32% share was taken by the cardiovascular system. That is just one thing for you to know. Followed by that, you had some of the infections or the respiratory diseases. But please note that the most common cause of death, COD, will stand for the cause of death. So in this module, I'll be writing cause of death very oftenly. So the most common cause of death in India in general, about all the population, all the ages, all the genders, it's the cardiovascular system morbidity. Second is, if you see among the ages, among the different years. So the report says that from year 2005, 2010, 2015 and 2019, we have seen a definite increase in the trend from the cardiovascular morbidity. Another point to be noted is that as far as the infections are concerned, certain infectious diseases, you can see that there is a definite decline. Next is importance for you over here is regarding the endocrine diseases. The endocrine in the past few years, in the 2 decades, we have seen a constant level of the endocrine diseases. But in the year 2019, we saw the deaths due to endocrine diseases have drastically increased. So there is a problem with the endocrine diseases. The infectious we have seen a decreasing trend, and there is a definite problem with the cardiovascular diseases. The deaths due to these have definitely increased over the last 2 decades. Coming over to what are the reasons for people to die due to cardiovascular morbidity? Of course, common sense, I think we all know that 1/4 of the deaths, 25% of all the cardiovascular deaths were because of the ischemic heart disease, myocardial infarction and coronary artery disease. So the most common cause of the coronary artery disease or the most common cause of the cardiovascular related death was ischemic heart disease. Next MCQ. The third point, you need to know that among the parasites or the infections, that was the second most common cause of death. You remember, right? So the second most common cause was infections, which is the most common cause of death due to which infection? It was general infection, that is septicemia, is the most common cause of infection related death. But I would like to highlight over here that tuberculosis was not far behind. 1/4 of deaths which happened due to infectious was because of TB. So TB takes the most common single infection in India for causing death due to any infectious disease is tuberculosis. Coming to the endocrine diseases, we have seen a drastically increase in the deaths due to endocrine diseases, and one of the biggest killer for endocrine diseases is nothing more or less but diabetes mellitus. Diabetes mellitus, 85, 86% or 90% you can say of deaths due to endocrine causes was because of diabetes mellitus. One of the major killer among the endocrine diseases is diabetes. Now comes your 5x5 star MCQ topic. What are the most common causes of infant mortalities? If you talk about the infant is age less than 1 year. So if you look at the infant mortalities from year 2019, beta, this is the latest report. This report I have not made. I'm just sharing with you the report that I have received from we have received from the government of India. So please note that the most common cause of death in infancy, it relates to, now the terminology has changed. The concept is still the same that you must have learned during the MCH or you must have learned from me during my classes. The concept still remains the same. It's just that the terminology has slightly changed. That in 2019, the MCCD has taken that the most common cause of infant deaths is conditions originating from the perinatal period. Conditions from the perinatal period. So what are the conditions? The first and the most important cause is hypoxia. Hypoxia, birth asphyxia. Most common cause is hypoxia or birth asphyxia and other related respiratory conditions, they take 28% of the total infant deaths. The next in line is related to prematurity, fetal maturation, or fetal lung maturity, or slow fetal growth, or IUGRs, or prematurity. It is responsible for 23%. So please note the terminologies have slightly changed. Which is the most common cause of death in infancy is now perinatal period causes. Out of the perinatal period causes, which is the most common cause, you have to remember it is hypoxia, birth asphyxia, and related respiratory conditions. So in general, if we ask about like which is the most common cause, you have to mark hypoxia more than prematurity now. Earlier, I used to say in my classes, earlier in my video sessions also, everywhere you must have heard, because the government was saying that the most common cause of death in infant mortality rate is prematurity. Please note it is prematurity still, but more than that we have seen hypoxia. If hypoxia is there in the options, you should be marking hypoxia. That's a major change over here. That is a major change point worth considering. So first is why does an infant die in India? It is because of the causes which arise in the perinatal period. Most important is hypoxia. Second important is prematurity. Next in line, what is the second most important cause? The second most important cause for children to die in the infancy is infectious. Which infection? I think we already talked, it is septicemia. Please do not mark pneumonias or other thing over here. In pneumonias, you can see is one of the important causes. Pneumonia is 2.4% of the causes of infant deaths, but it is lesser than septicemia. Septicemia is more important, more common than pneumonia. So please note these are some of the important MCQs I wanted to highlight over here. Just a very quick summary of what you have learned over here. Infant mortality, what is the most common cause? We need to answer perinatal causes. Out of the perinatal causes, which is the most common cause? You have to answer hypoxia if it's there in the option. If not there, go with prematurity. The second most common cause is infection. Out of the infection, which is the most common cause? Septicemia and not pneumonia. Pneumonia would be somewhere later. And definitely diarrhea, malaria, it's not there in the game right now. So the most important cause first would be hypoxia, second would be prematurity, third would be septicemia related deaths. So this is the order that has changed for the infant mortalities in India as per the medical certification cause of death report 2019. And now the next group is age group after 1 year. So earlier we had seen from 0 to 1 year. Now I'm going to talk about the age groups 1 to 4 years, right? So under 5 years, excluding the infant causes. Why does a child die after 1 year? The most common cause, which has been shown by the report, was asked in your AIMS exam, it was asked in your INI set exam, that what is the most common cause? Is it septicemia? Is it malaria? Is it diarrhea or pneumonias? Please note that the most common cause is now infectious causes. For child to die within the infancy, the most common cause was the causes related to the perinatal period, the hypoxia and the prematurity. But after 1 year, it's not about the perinatal. After 1 year, the causes of deaths are predominantly infections. Out of these infections, what is the most common cause? It is septicemia. Please note that septicemia forms the first stage. Next in line, you can see that it is pneumonias. So one is infection causes. Second in line, the infection could also be because of pneumonias, which is very important. Please do not mark diarrhea or diarrheal diseases over here. You can see that diarrhea is only, you can see that pneumonia is 8%, whereas the diarrheal diseases is 2%. So we can say that pneumonia is 4 times as common in children as compared to the diarrhea. And malaria is far too lesser, it's only 0.4. So that was the MCQ which was asked in your exam. Next in line is malaria. So the best answer over there in your exam was septicemia. Septicemia is responsible for 11% of the deaths of child after 1 year but less than 5 years. That is called as death in age group 1 to 4 years. So please note the most common cause is septicemia, followed by pneumonias, followed by diarrheas, followed by malarias. So, but please note prematurity and all those do not come. Now, if you talk about the general category, we already talked about the infant deaths. We already talked about post-infant deaths, under 5 deaths. So now if you take the general category, that is from 0 to 4 years, you can see that in the infants, I'll just show you again. Can you see that the infant deaths, the perinatal causes was whooping 70%. Infant deaths, 70% are dying because of the perinatal causes, which include the hypoxia and the prematurity. So therefore, in the 0 to 4 years, the maximum deaths which happen will be because of what? Again, same answer, it has to be the perinatal conditions. That is same answer. It is hypoxia and prematurity. So for your exam, you can remember over here 0 to 4 years bache. The answer would be most common cause is again that overall answer has to be the perinatal period conditions which arise during the perinatal period. Most commonly we are talking of hypoxia and we are talking of prematurity or fetal lung maturity, fetal slow growth or IUGRs and things like these. So these are the very important things you need to understand. After this perinatal period, then you have the infectious causes. Same sequence is going to follow. In fact, whatever sequence is there for the infants, it's the same sequence for under 5 years also. It's the same thing. Now comes to the next important cause, like what is the cause of death of child after 5 years? Important to understand, why does a child after 5 years die? After 5 years, you can see that maximum children are dying due to infection causes. Infection is 1/4, 25% of the children deaths are because of infections. Second in line, now a new disease has started showing up, that is the cardiovascular diseases, and then you have is the pneumonias. But more importantly, you would like to remember that for children after 5 years, below 15 years, it is infections. Then once the child goes into adolescence after 15 years, the most important cause is now injuries. That is again a prospective MCQ, that after 15 years during the adolescent or young adulthood, young adults or adolescent age group, what is the most common cause of a person to die, of a child to die, in fact, I would say, is because of injuries, poisoning, or other consequences of external causes. Biologically, the person is pretty fit not to die because of diarrheas or pneumonias or infections or prematurities or things like this. It is injuries. Followed by that, you have the cardiovascular system morbidity. After 25, it's almost always, it has to be cardiovascular disease, which is the most common cause. So anyways, I'm not here to bore you with all the data over here. Just for your exam bit, I have made a summary chart of all these. This is around 200-page guideline, which I have summarized into this whole one chart for you. So what you generally need to remember is, look at the blue color shaded areas. The blue shaded areas, can you see these blue shaded bars? The blue shaded bars are either we are talking of the prematurities or the perinatal causes. Perinatal causes. You remember perinatal cause, that was hypoxia and prematurity. So if you talk about the first column, that is the infant deaths, majority deaths are because of the perinatal causes. As the child would grow forward, the yellow colored can you see that the yellow colors have started increasing in size? Can you see that? Appreciate that yellow is for the cardiovascular diseases. As the child moves forward, the cardiovascular problems, they somehow increase, and after the age of 25 years, you can see that the cardiovascular morbidity is 20 to 40%. You can generally remember that out of all the deaths which happen after the age of 25 years, out of all the deaths, 20 to 40% are because of the cardiovascular deaths. Very important. Below than that, you have these orange colored. Can you see the orange colored things? Orange is very high during the very young ages, and as the child grows, the orange decreases. Orange stands for the infectious causes, which orange stands for the infectious causes. So in this single graph, I have tried to show you that as the age progresses, the infectious causes are going to decline as the age increases. So in young age, it is whooping 25%, and as they go, the person increases in age, it comes down to as low as 6 to 8%. So generally speaking, the cardiovascular is in tune of 20 to 40. The infections are gradually decreasing, and the blue colored ones, this blue colored specifically is about the injuries. This blue colored are the injuries, right? So you have these injuries somewhere in the adolescent. After that, you have the cardiovascular, predominantly infections, and predominantly prematurity in specific age groups. So just a summary for you, what you need to remember for your exam, what you have done in the past few minutes. This is the summary table. Take home message, sweet take home messages that bache, if we ask you in infants, what is the most common cause of death? You need to answer hypoxia and prematurity, both of which are during the perinatal. Hypoxia, better answer than prematurity, a big change for you. Next is age 1 to 4 years. After 1 to 4 years, what is the most leading cause of death? It is infections. It is not prematurity. Infections, which is the most common infection you should mark, septicemia more than pneumonia, more than diarrhea. After age 5 years, predominantly it is infections which cause the death, but below 15 years. 15 to 25 is the peak time where injuries or poisoning will happen. That takes the center stage, injuries and poisoning. And then after 25 years, you have the heart disease, which is the predominant cause in any age group. That's a general understanding. That's a crux of the whole MCCD report, 200-page guideline report. Next is if we ask you another type of MCQ, what is the most common cause of death in infants? Please note that the general answer should be conditions which arise from the perinatal period. First is hypoxia, second is premature. If we ask you what is the most common perinatal reason, answer is hypoxia. Answer is hypoxia. If we ask you that what is the most common infection in the under 5 child, the answer should be general answer, that is septicemia is much more common than pneumonia, which is more common than diarrhea, which is more common than malaria. So malaria would be the last one. Next is most common cause of respiratory related death. Answer is pretty simple. It has to be pneumonias. So these were some of the questions which can be asked to you regarding the medical certification cause of death released in year 2019 by the Government of India under the Office of Registrar General of India. A couple of MCQs for you to remember for your exam. Next is, let us come to this new topic, that what are the death certificates? Death certificates. Death certificates, as we have already discussed in your CRS, that is the civil registration system, we are taking care of the births and the deaths under the Registrar General of India. So the death certificate, it has broadly 2 parts, or in fact 3 parts. So you have a part 1, then you have a part 2, and then you have other part. Okay. So you can say that there are 2 parts, which are the classified part 1 and part 2, and then you have the other sections. So part 1 will always talk about what? Part 1 is the cause of death. It is the direct cause of death. It is related to the direct cause of death. Whereas part 2, these are the associated features, which are indirectly related, which may be indirectly related to death, but they do not cause the death directly. And part 3 is other causes, like other part is the other causes, where we talk about the pregnancies, about the female is there or not there. So please note the other part we are going to, in the death certificate, we will check for the manner of death. Second, we have to see if the person who died was a male or a female. If it was a female, is the female who died was pregnant or not? So it has to be pregnancy related death has to be asked. And third is about tobacco smoking. Tobacco smoking is also asked. These are the predominant gross general categories of the death certificate. If you talk about the direct cause of death could be part 1A, 1B, 1C, and so on. It could be 1C, D, E, F, whatever number. But generally, we divide the direct cause of death into 3 parts. You can add whatever we want. What is part 1A? Beta, part 1A is the immediate cause of death. Part 1A is the direct immediate. It is the immediate cause of death. What do you mean by the immediate? Immediate means what was there, the last diagnosis before the death, that is called as immediate cause of death. We usually do not answer cardiorespiratory arrest or respiratory arrest or cardiac arrest as the direct cause of death, because that is just a mode of a person to die. But what was the last diagnosis which led to the failure of the heart or heart to stop beating? That is what is a cardiorespiratory arrest, right? So what caused that heart to stop beating is what is part 1A. It is the last diagnosis which was made in the person. And then 1B and 1C, these are called as the antecedent causes. Antecedent causes means part 1A was because of what? Like 1A, you have 1B, 1C. So technically 1B will cause 1A, 1C will cause 1B. These are called as the antecedent causes, whereas the 1A, that is called as, 1A is called as the immediate cause of death. 1A is called as the immediate cause of death. So these are some of the things you need to remember for your exam. So I know that this probably, I've taken the whole snapshot of the death certificate. I know it's a very small one for your screen to see. I will be zooming it, but I just want to tell you that the death certificate is under the cause of death. You will take part 1, part 2. That's the only 2 parts. And then you have the other parts. In other parts, we talk about the manner of the death, the pregnant female, yes or no, and things like these. A little bit zooming into it. So the part 1, you can see that part 1 is type A, 1A, or we can have the 1B or 1C. Or we can have is the second part, other significant causes contributing to death but not relating to the disease or directly causing the condition. So in the part 2, please note, we always write between with the other causes of death. And then you had the other parts. Other parts is we always talk about the interval of onset and the time of death approximately. Then in the lower part, the lower section of the death certificate, it talks about the manner of death. Like what type of death was it? Was it a natural death, accidental, suicide, homicide, or pending investigation? So that is generally for the police people to take care of, like what was the manner of death. Then is in case the deceased was a female, in case the person who died was a female, was the pregnancy associated with the death? You have to answer yes or no. And if the death was a pregnancy related, was there a delivery? Answer is yes or no. So these are the parts of death certificate. Just to help you remember again, please note what is the immediate cause of death, bache. The immediate cause of death is part 1A. The antecedent, repeat with me, antecedent cause of death is part 1B or 1C. So now there are just 1 or 2 points for you to know, bache, that the death certificates, first thing is that death certificate is the form number 4. And this is a part of the Appendix 2. Appendix 2, form number 4, you can remember this for your exam. Next is, I would also like to share with you that the death certificates are of 2 types. There could be deaths which happen in the hospital. So we have a death certificate for the hospital events, and there could be deaths which do not happen in the hospital. So therefore, we can have death certificates for the non-hospital events. If you just look at the screen over here, in small words, it is written for hospital events. I would also like to show you that there is a death certificate for non-hospital events. What's the difference between a hospital death certificate and a non-hospital event death certificate? The only difference which can be asked in your exam is that in the non-hospital death certificate, can you see that they do not ask about the manner of death? Is not asked in a non-hospital, whereas in a hospital death certificate, they ask about the manner of death. So you need to memorize that the manner of death, the point that we have already talked, manner of death is asked in the hospital events death certificate. It is asked in the hospital events death certificate. So there could be a simple silly MCQ that which of the following is not a part of the non-hospital death certificate. Please note that manner of death is not asked in a non-hospital based death certificate. Now very quickly, just let us take a few examples on how to fill in the death certificate. Please remember that in part 1A, we never fill the death certificate with the immediate causes like cardiorespiratory arrest or things like these. Let us have a look at this question. Make a death certificate for Mr. A. Mr. A is a 60-year-old male presented to emergency with a sharp epigastric pain and vomiting since 48 hours. The BMI is 33 with a history of chronic alcoholism and smoking. The patient was admitted with the diagnosis of acute exacerbation of chronic pancreatitis, and while on the management on day 2, the patient developed cardiorespiratory arrest and died. So what are you going to fill, or how are you going to fill the death certificate? What are you going to fill in the part 1A? Can you see that this patient who's coming to the hospital was admitted with the diagnosis of acute exacerbation of a chronic pancreatitis? So what is the immediate cause of death, or the first line 1A? Line 1A will be the acute exacerbation of chronic pancreatitis. So when in the death certificate, we never write in short forms. We always have to write in complete forms that it is acute exacerbation of chronic pancreatitis. Never use the short forms. We are not going to fill in cardiorespiratory arrest. We have already had a word on this. What are the antecedent causes? Please note that the antecedent causes for having an acute exacerbation of the chronic pancreatitis is pretty simple, that it is a chronic pancreatitis. And why did chronic pancreatitis happen? It is probably because the person was chronic alcoholism. So that was, as we see, that there was a history of chronic alcoholism and smoking. So smoking, will it cause acute pancreatitis immediately, directly? Answer is probably no. So smoking could either be put in the other part. So other part could be smoking. We can also add obesity, because I think that the person was obese, BMI was 33. So that's how you write the death certificate. Please note in part 1A, we write the cause of death, which was just preceding to the event of death, just before the death, what was the last diagnosis. That is part 1A, immediate cause of death. Okay, let us take another example. If you see that we want to make a death certificate for Mr. B, Mr. B probably was a 70-year-old male admitted to hospital with a lower quadrant pain of many weeks duration. It's a old thing. There was progressive malaise and weakness. On examination, the patient has large liver with forefinger depth below the costal margin. ECG shows a bundle branch block. The CT shows numerous metastases in the liver. Needle biopsy was diagnostic of a moderately differentiated hepatocellular cancer, and the patient was started on chemotherapy. Later, the patient developed DVT of lower limb, probably because of some coagulopathy, some liver problems, admitted to hospital with malaise and shortness of breath. Shortness of breath. On day 4, the patient developed pulmonary embolism and died due to a massive cardiorespiratory arrest. How to fill in the death certificate? It's quite a complex history probably. So let us start from below. I always, whenever we get a clinical case and whenever you as a doctor who's writing a death certificate, you should start from the latest event first. So the first event which happened in the timeline just before the death, it was probably, we need to talk about pulmonary embolism. So in line 1A, the immediate cause of death, this patient died because of pulmonary embolism. That was the last diagnosis which was made. Next is, why did we have this pulmonary embolism? Probably the patient had deep vein thrombosis. So this patient developed pulmonary embolism because of deep vein thrombosis. Why did thrombosis develop? Because there was part 1C now, that there is end-stage liver disease, right? You need to write in full forms. Deep vein thrombosis and end-stage liver disease or hepatocellular cancer. End-stage liver disease could be due to HCC, that is hepatocellular cancer. So you can have liver cancer as 1D. 1C will talk about ESLD. Usually we do not put 2 or 3 things in single line. So you make line 1A, 1B, C, D, and so on, whatever number you want. In the other causes, in the other factors, other significant factors which can contribute to the death but not directly causing it, this could be that in the MCQ, in the question they had given about the right bundle branch block. So there was some cardiac pathology also. We can write it as a right bundle branch block, or maybe we can write as cardiac arrhythmias. Arrhythmias were noticed in this patient. So this could be your part 2 of the death certificate. So that's how you just fill in the death certificate. Let's take another example. This is an example for Mr. C. Mr. C, again a 70-year-old male, a known case of CA esophagus with relapse and pulmonary metastasis on chemotherapy, reported to the hospital for acute shortness of breath with suspicion of COVID-19. A bronchial stenting was done for bronchial metastatic infiltrates. Later on day 3, the patient again developed acute shortness of breath with falling SpO2. Subsequently, he developed a nosocomial pneumonia, and the patient was managed with high-end antibiotics, for which he failed to respond and died due to cardiorespiratory arrest on day 4 of the admission. So how do you fill in this death certificate? So technically speaking, it is very simple. Like, of course, death is an unfortunate event, but the death certificate is evident over here. 1A, what was the most recent cause of death? Most recent cause of death was a pneumonia, nosocomial pneumonia. Nosocomial pneumonia, or you can write down staph pneumonia or whatever, lobar pneumonia, some special type of pneumonia. Part 1b, what caused the nosocomial pneumonia? The nosocomial pneumonia was because of maybe this patient had metastatic infiltrates. They were bronchial metastatic. There was pulmonary metastasis. And why did metastasis happen? Because common sense, there was a CA, esophagus. So esophagus, cancer of the esophagus caused a pulmonary metastasis. Metastasis caused somehow a decreased function of the lung, and the patient was already with bronchial stenting, and therefore there was nosocomial pneumonia. So probably there was no other associated factors, is nothing mentioned as far as this MCQ is concerned. Let's move to the next MCQ and let's have a word about Mr. D. Another example for you is Mr. D, a 50-year-old male, old case of CCF, congestive cardiac failure, old case, right? It's old case with adrenal cancer. Okay, with adrenocortical cancer with the primary hyperaldosteronism, is admitted to hospital with a sudden loss of consciousness with after an episode of vomiting just 30 minutes ago. The CT showed, that is what the diagnosis is, massive cerebellar hemorrhage. So he was on high-end dose for management of the malignant hypertension. That's again a diagnosis of interest. There was malignant hypertension. The patient died 2 hours of hospital admission following a massive cardiac arrest. So how are you going to fill in the death certificate? So 1A, why did the patient die? The patient died because of cardiorespiratory arrest, but why did the arrest happen? Probably it was because of a cerebellar hemorrhage. But hemorrhage will not kill a person because of the cardiorespiratory. Probably you can see that there was an episode of vomiting, the question is saying. So the question is saying episode of vomiting. So we just need to find it over here, that why did the patient die? It was because of probably the aspiration of gastric contents. Aspiration of gastric contents might have happened because of vomiting. So why did the vomit happen? It was because of the immediate causes, cerebellar hemorrhage. Why did the cerebellar hemorrhage happen? Common sense, because of malignant hypertension. That is what the question also says. Malignant hypertension happened to that patient. And then 1D, there is another problem. Why was there malignant hypertension? Because of adrenal cancer. There was primary hyperaldosteronism, that is adrenal cancer. Any other associated cause? Yes, we do see old case of CCF. So associated causes or the other causes could be, that is the part 2, right? That's what we had discussed. In the part 2, bache, we are going to write about the old case of congestive cardiac failure. Congestive cardiac failure was one of the contributing causes, but of course not directly leading to the death of the person. And CCF would be written in part 1D. So that's how we write about the death certificate for this person. And that's all for most of your questions in death certificates and medical certification causes of death. Thank you so much for watching this module.